Hello everyone, myself Dr. Pratik Garg. So let's talk about Killian's dehiscence. I'm your ENT faculty definitely. So Killian's dehiscence, what is this? Firstly, let's understand the pharynx musculature. That is how this dehiscence is arising from which area. So we all know pharynx is having the circular muscles. Three pair of circular muscles: superior constrictor, middle constrictor and inferior constrictor. So suppose this is our pharynx. If I draw the diagram with the face, so in the face, our pharynx is a long tube with upper fibers are superior constrictor, middle fiber are middle constrictor, and the lowermost fibers are inferior constrictor. Inferior constrictor, which are the circular muscles, they are having two parts. First part is thyropharyngeus muscle and the other part is cricopharyngeus muscle. So this cricopharyngeus, these two, both side, these are thyropharyngeus. And this lower one is cricopharyngeus. So the thyropharyngeus fibers are oblique fiber. Cricopharyngeal fibers are circular fiber. So what happens because of this arrangement like this? Thyropharyngeus oblique fiber, cricopharyngeus circular fiber. They are both present in inferior constrictor muscle of pharynx. So there is a gap in between. This gap is known as Killian's dehiscence. This gap is known as what? Killian's dehiscence. And if from this gap, if suppose there is mucosal outpouching, the mucosa present in the pharynx, if because of some factors it comes out with formation of bag, that is known as Jenker's diverticulum. Understood? So Killian's dehiscence is a dehiscence present between thyropharyngeus and cricopharyngeus. So between them, if there is a gap, if there is mucosa coming out because of some force, then it is known as Jenker's diverticulum. It's a false diverticulum. Why false? Because not all the layer of pharynx is present. Only the mucosa is there. So Jenker's diverticulum is a false diverticulum because only mucosa outpouching is there. More commonly, it is firstly starting posteriorly, पीछे से निकलता है, then it appears in the neck laterally. More commonly towards left side. Okay, so it is arising posteriorly, then coming laterally, most commonly towards left side. It also known as pulsion diverticulum. And what are the symptoms? It is presenting with a dysphagia. क्या होगा? Patient अगर खाना खा रहा है तो some food will go inside this pouch. And with this patient will have a feeling of satiety, मतलब पेट भर गया मेरा या इरिटेशन हो गया, nauseating फील होगा. जब भी पेशेंट रात को सोने जाएगा, इस पाउच से some food may regurgitate, okay, and then that will cause nausea, vomiting, dysphagia. So patient will present because of this pouch dysphagia. ये कुछ pressure डालेगा normal pharynx पे, उसके pressure से भी there may be dysphagia. So it is presenting with dysphagia and regurgitation of food, mainly in the night. There may be nocturnal cough and halitosis, foul smell. Okay, खाना अगर यहाँ पे इकट्ठा होगा, that will smell, that will stink, that will give the bad breath. Now, what is the sign? If there is a swelling presenting on the left side, if we press it or compress it or try to palpate it, some gurgling sound will be there. Pat, 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 ऐसा gurgling sound will be there. That is known as Boy's sign. So Boy's sign is typical of Jenker's diverticulum, which means gurgling sound on palpation of the swelling which is presented in the neck. Now what is the investigation? What you can do? We'll go for barium swallow. If we do the barium swallow, this is a picture showing the barium swallow. बेरियम swallow, हम जब बेरियम को पिला के उसको हम जब एक्सरे करते हैं, उसके बाद में we can see a diverticulum here. Small outpouching we can appreciate in the mucosa, in the pharynx. So that is confirmatory of what? Of Jenker's diverticulum, which is a false diverticulum. Okay, so look at the X-ray, you can see a diverticulum, small outpouching of the mucosa there. Now what is the treatment? Look at this picture. The surgery which we are doing for the treatment of this disease is known as Dollmann's operation. What is this Dollmann's operation? Then we do to make a single cavity between the pouch and the pharynx. What